elbow essentially is an irritation of the tendon on this part of your elbow. So it's always on the outside. On the inside, it's actually called golfer's elbow, completely different problem. The reason why this is more common in tennis players is because when they swing the racket, they go across their body and then they typically are flexing their wrist down. It puts a lot of strain on that tendon there. So irritation will develop and then it'll hurt for them to swing repeatedly. Now this also is seen not just in tennis players, it's seen in occupations that involve using your hands, using your wrists, different things like that. But most commonly it is seen in tennis players. This part will get extremely inflamed. The pain can sometimes radiate down the forearm or it'll just stay there very locally. It's very sensitive to touch, and then different movements of the wrist like wrist extension or even just moving the middle finger will aggravate that spot way up in the elbow. You can sometimes, if the nerve nearby is irritated, it can create a little bit of numbness and tingling. That's a little bit more on the rare side. When the tendon first gets irritated within the first 0 to 7 days, it's considered a tendinitis, which means that resting it, deloading, maybe taking a little bit of time off of tennis will help to ease that pain. But if you continue to ignore that, it will turn into what's called a tendinosis. So you won't see any changes, but it'll stop responding to rest or ibuprofen or some of those other things that you were taking, and you'll live in a more persistent state of pain. And this becomes a problem and a little bit trickier to treat. So let's talk about that. So a tendinitis, like I mentioned, it's going to be rest, anti-inflammatories is usually what you want to start with. If it's not gone after that 7-day mark, then you want to consider starting to load the tendon. So with different types of exercises that will make it stronger, make it more resilient, and help you get back to playing tennis at full capacity. The other things we do for it are soft tissue techniques. So we'll either use cupping on this area, or we'll take a scraper and we'll actually use that to loosen up the tendon, increase blood flow, and get you moving a little bit better. We also have other tools like blood flow restriction training where we can restrict the blood flow to the tendon and we can actually work it out with less weight or less stress, but your body will perceive it as you're doing more stress and strengthening it up much faster. We can also do dry needling where we'll go directly into the muscle tissue, not the tendon itself, but the muscle tissue to treat any muscle knots, help alleviate tension, and then also increase blood flow to that tendon. So a combination of these things can help you get back to sport as quickly as possible. So if you're struggling with tennis elbow and you haven't gotten a diagnosis or you've been treated for a while but it's not getting better, feel free to reach out to us. If you like the information we're providing on this channel, please click the subscribe button below.